name is Kelly Dominique Hudson. I am the founder and principal broker for Peridom Insights. We are a health insurance brokerage here in Montgomery County, Maryland. And how we pour back into the community is advancing health equity through health literacy and advocacy. It's such a great question because it started out as like a tiny little seed. And what I've noticed is on this side of town, East Montgomery County, I actually live on this side of town. I'm a parent here. I'm civically involved here, and I see the disparities firsthand. And so that really propelled my passion for doing the work that I'm doing right now. Connectivity. I wanted people to come into a space and connect around a common idea. I wanted them to walk away with resources that they can use to access healthcare. I wanted them to see that there is a community of people who are passionate about the same thing. Truly, I hope that people walk away with information, resources, tools, and insights that they did not have before. I wanted it to be a montage of things, like an admixture. One of the common phrases in the Black community is that Black people aren't a monolith, and so I wanted to approach this conference with that same lens. Absolutely, it's more than one way to skin a cat, right? So everybody here, I'll say, is taking their own approach at advancing health equity in the spaces that they're in to get to that same end goal.
Dr. Nina Ashford, Chief of Public Health Services for Montgomery County Department of Health and Human Services. When Kelly reached out and shared the overall title and focus of the event, Advancing Health Equity and Health Literacy, that is central to what we do at the health department every single day. And so it was so important for us to be here, to be able to share what we're doing within the county, to be able to share the programs and supports that we have, as well as to reiterate our commitment within our work to advance health equity. And advancing health literacy is done through events just like this in the community, where community members are able to come in, to learn, to share, to make those connections, to get resources. So it was a natural yes and a natural fit, and is directly aligned with the mission of what we do within DHHS.
Kate Stewart, I'm on the Montgomery County Council and serving as the council president. So I wanted to be here today because it's about bringing together the community, sharing information, and hearing from members of the community about health and well-being, and that is something we really need to be prioritizing right now. So as we know, Montgomery County is an incredibly diverse place, which is something we celebrate. And we also need to look at critically, because not all of our communities are served as well as they could be. And we do see disparities in a number of areas, and access to healthcare is one of those areas that we do see disparities.
So my name is Kenneth Smith, and I am a high school teacher in Montgomery County Public Schools, and I teach hip-hop history and culture, AP African American Studies, sociology, and U.S. government. Yeah, good question. So hip-hop culture and health equity are sort of merging. Within the last few years, you're starting to hear about a lot of MCs, a lot of people within hip-hop culture talk about their mental health challenges. And this is something relatively new, even within the Black community, Black and Latino community. It's a topic that we typically haven't talked about in the past, but I think it's a great example of youth culture being the vanguards for talking about this important issue, which has been neglected in our community. So what I'm here to talk about today is how hip hop culture is merging with this discussion about mental health. And myself working with young people, and some of the conversations that we've been having in class, some of the assignments that they do, I realize that some of these issues are mental health challenges. And myself growing up in a suburb of New York City, way back, I was alive before hip hop was hip hop, before it existed. These were issues that were never talked about at all. And now that I'm very reflective about older MCs that I grew up with, that many of their lyrics, their songs, it was a cathartic release for them. And now that they have the language, they have the lens to frame what they were going through in the past into their music today. And now you see a lot of younger artists are very open. So with Gen Z talking about mental health issues, it's no big deal for them. It's normative for them. And so I'm glad to see that hip hop is moving in this direction. And you also have old school hip hop pioneers like Fat Joe, Method Man from Wu-Tang Clan, and many others that are openly talking about their mental health struggles. So you have the old school merging with the new school. And so I'm here to see how we can merge the two and to keep this movement forward, but keeping ourselves connected to young folks. And so we're hoping that when we begin to have these conversations, I want to take it to the next level. It starts with a conversation, it starts with the narrative that this is okay, but then the next step, how can I pursue this further in my own life? If I want to seek professional help, if I want to talk about it, it's okay. Like Maya Angelou said, when you know better, you do better.
Dr. Adebola Ajao. I'm an epidemiologist. I've been working in HIV for over 20 years. The number of HIV cases are coming down, but it's not coming down fast enough. That's the problem. We have this goal to end HIV by 2030, and we're not quite getting there. I think people have lost that focus because there's so many other epidemics. We just went through COVID, there's the opioid crisis, there's so many other things going on. I don't think people are paying as much attention to HIV. But looking at the data, we need to pay attention, especially in the Black community. It's killing us. I think people have to know their status. I think frequent testing, routine testing is so important. People can't wait 8 years before they know their status, because while they're infected and they don't know, they're infecting other people. They're transmitting this infection in the community. So I think the community has to come together.
Certain communities are under attack, and increasingly the attack is becoming more and more severe and consistent. And we need to let people know that there are folks out here that are working for you, that are here to advocate for you, and conferences like this, it's a first step.